everyone, my name is Shivani Sritharan, and today I'll be talking a little bit more about stress and anxiety disorders. So let's start with stress. What is stress? Stress is a physical, mental, and emotional response to something that causes us tension. We've all experienced stress in the past, and we all will continue to experience it in the future. It is a normal part of life. There is no such thing as a stress-free life, as much as we try to aim for that. Whether it was a loss of a job, a new role at a job, a change in household, a birth of a new baby, a loss of a relationship, these are all stressful moments in our lives. Stress is not always a bad thing. It can be a good thing. It helps us to be more productive. If there is a big exam coming up or a deadline at work, you might realize that you might sleep a little bit less, put in more work hours in order to accomplish those goals. If it's just for a few days, stress isn't a bad thing at all. It can make us more alert, make us more productive. And we've all overcome stressful events in our lives, and we will continue to overcome this. When stress turns into anxiety, and this anxiety floods our home lives, our work lives, our social lives, this can be a problem, and this may be signs of an anxiety disorder. So what are anxiety disorders? Just like diabetes or asthma or high blood pressure, an anxiety disorder is a diagnosis given by a healthcare professional, usually a doctor. The most common form of anxiety disorder is generalized anxiety disorder. This might be when a person experiences overwhelming, excessive amounts of stress that is almost uncontrollable for weeks and months on end. It affects all aspects of their lives, at work, at home. Their stress levels are always high. This might result in poor sleep, especially difficulty falling asleep. The thoughts before they go to sleep might be circling around the things that happened over the past day and things that are going to happen in the future. Their focus and concentration might be affected. They might make careless mistakes. They might be more irritable and have a loss of temper and snap at those around them. They might have muscle tension, tensing the neck, tensing the shoulders, resulting in headaches and upper back pain. Sometimes, but not always, anxiety disorders might have a panic component. So what are panic attacks? This is a physical response to anxiety, resulting in palpitations, which is a fast heart rate, shortness of breath, dizziness, tremors, shaking, a sensation of choking, feeling like the world's going to end, or feeling like you're going to die. This intense symptoms that one person may experience may last a few minutes. It might be provoked or triggered by something stressful, but it can sometimes happen randomly as well. Anxiety disorders are very common and very manageable. If you think you are experiencing this, or you think a loved one is experiencing this, please reach out to your family doctor. Often they can be the first point of contact and provide you with a wealth of resources for treating and managing your anxiety. The treatment plan may involve medication at times. Medication can be very helpful at managing excessive worry, anxiety, and panic. Talk therapy or cognitive behavioral therapy may also be an important component of managing anxiety and stress. It can help restructure and reframe your way of thinking to more helpful coping mechanisms so that we are able to tolerate stress, anxiety in our lives. It is also important to make sure that we all have good sleep habits, usually sleeping at the same time every day, waking up at the same time every day. It is also good to develop healthy coping mechanisms. This may include exercise, which is proven to be beneficial in managing and treating mental health diagnoses. Regular exercise should be a part of everyone's lives, for both our mental health and physical and heart health as well. But we're all different. We all have different interests. For some, relaxation means watching their favorite TV show. For others, it may be reading a book, listening to music, doing some crafts. For some, it may be cleaning. So whatever your relaxation may be, explore that, cultivate that, and try to incorporate that as a regular part of your life. Stress and anxiety is unavoidable. The past year has taught us that there are many things that are going to happen that are out of our control. But it is important to realize when you can handle things and when you need help. And you should feel comfortable reaching out to your family doctor or a trusted loved one for help. I hope you found this video to be beneficial. Thank you.